Hey everyone, you may have heard of a phenomenon called shock fallout after hair transplant. What is that? And what can we do about it? So shock fallout is the hairs that you already have on your scalp. When we transplant next to them, they get a little shocked, they get a little jolted. And sometimes that results in those hair shafts being released. So you get a fallout of the existing hairs in your scalp because of the kind of trauma or the inflammation from the procedure. This is not by any means permanent. Those hairs, the follicles are still under the skin and they will grow, but sometimes patients can be a little bit scared. I'm thinking, oh my God, I have less hair than when I even started the process. Completely normal. Now, what can we do to either decrease the results of shock fallout or completely reverse it? First, I like to put my patients on nutraceuticals to protect the hair follicles prior to a transplant. So generally, if you come and see me after the consultation, once you've booked your hair transplant, we put you on certain vitamins that tend to protect the hair follicles and give it more strength, so they're less likely to undergo shock treatment. Second, I've started to do TED treatment to the scalp. Now, TED is for transepidermal delivery of medication to the scalp of TED serum that tends to help protect those hair follicles and prevent them from falling during the transplantation. So I generally recommend each one of my patients to get at least one treatment a couple of weeks before their hair transplant. This way we decrease the risk of shock treatment. The other thing we can do is we can do further TED treatments after the transplant to stimulate fast recovery of those hair follicles. But at the end of the day, these hairs do grow back, so it's not a permanent loss. But about 10% of patients can undergo this process, which I understand can be a little bit scary when you see it, but rest assured, the hairs come back, there is no problem, okay? If you guys have any questions about this stuff, you can always contact our office or set up a consult with me and we can go over it further. Thank you.